Hi, this is Kat Jersich from HIMSS TV, here with Michael Gleeson, Chief Innovation and Strategy Officer at Arcadia Health. As we know, COVID-19 has continued to wreck the country, and specifically patients of color are at an increased risk for suffering and dying from the disease. So, given that circumstance, why is it so important to track population health right now?
It's important generally, but it's also specifically important for those populations, as you mentioned. So it's kind of there's this concept I've been thinking about as we've been trying to best help our customers, major health systems at various different regions across the country, deal with the pandemic, the impact it's had on those health systems, and the impact it's having on their patient population in general, and as you mentioned, in many cases, with a heavier burden on persons of color. Health systems do a really great job of determining what to do next with you as a patient when you're in the office, but they don't do a great job when you're not in the office, when you're doing when you're going about your general life on a daily basis. And that's where Pop Health comes in, right? That's where managing your overall population and using the data that's available on those patients to better manage that population helps a health system significantly. And that becomes pretty significant in a pandemic, when you maybe can't go into the office, or you maybe can't actually connect with your healthcare provider, or for whatever reason you're more distant than you may usually be from the healthcare system, or you're just a regular, normal, healthy person and realize that you may actually have a bunch of things that need to be addressed now. So being able to gather information on those patients, combining data from your health history, so your claims history and the data from various different electronic medical records that you may have interacted with, creating that longitudinal patient record or health record, and then applying additional data sets into that really help the health systems identify actions that they can take on patient populations outside of having to call them in for a visit and engage them. So that's one of the primary areas where we've been helping our customers stratify their populations using that kind of information to identify patients that are high risk for complications from COVID-19, or that have other chronic conditions and they're otherwise medically or mentally vulnerable to conditions that could be exacerbated by a lack of care or a lack of regular engagement with the provider community. And by keeping that information available, by keeping race available where we have it, it helps our providers start to hone in and target those particular communities and potentially address a different approach for how to do that. So it's been, it's really important normally to better manage chronic conditions and other kinds of patients. But in a public health crisis and a pandemic like we're in, that additional information and the ability to reach out to the rest of the community can be really critical to those patient populations. And we've seen that within our provider communities, particularly as they've used those lists to create, it creates an actionable list of activity to engage with. There's different kinds of concepts that those patients get queued up in, if you will. Some are for chronic condition management and a face-to-face if they want to Zoom, or a person-to-person touch point with a care manager, or they're an automated sort of virtual care interaction where you're sending people a questionnaire to check up on their current health conditions. You can use that to check up on progress related to COVID-19. As I'm sure you've heard, many people who are sickened by the disease are essentially, they go into the ER once and they're sort of said, hey, just go home, and if you get really sick, come on in. And that doesn't feel great. I'm assuming I've lucky enough not to have had that situation happen to me. But you can use these sort of daily pings to check up on those patients if you want to. You can also do the same thing for chronic conditions on a more measured pace. And one of the other areas our customers have found some really high success in has been pinging populations of patients that were in regions of their city or particular parts of the town, and sending them direct messages with information. So this was much more useful back in March and early April, where nobody really knew what was going on. And for most of the population, people trust their doctor, which they should do. And this was a really nice way of getting that information out in a long form format directly to the cell phones of their patient population. And we hit up hundreds and hundreds of thousands of people that way. And, it doesn't help everybody, but if it affects, tens of thousands of people or anything like that, it's super worth it. And we have a number of patient level stories from our customers that have confirmed the value of that outreach and the value of the additional focus that we've helped our customers bring around managing the pandemic.
Going back to that sort of point of care aspect, you mentioned virtual care, you mentioned in-person care. How can providers and your clients specifically use Arcadia Analytics to improve patient care at that point of care?
Well, one of the ways that we help. So first and foremost, we support our customers managing that population level. So for us, our initial engagement level with a health system is to help them manage patients when they're not necessarily in the care setting.
Mm-hmm.
However, when you do that, there's a lot of information that is really helpful to be presented in the care setting, as you might imagine. So we handle that by pushing information back into the EHR with a sort of bidirectional communication for certain electronic medical records or certain health systems that have the resources to enable that kind of connectivity. And in others, we have an application called Arcadia Desktop that we put on the desktop of our customers, and it is able to read what's happening on your screen and overlay particular pieces of information whenever you look up a particular patient. So if we find a match on that patient, we pop up information in an overlay, if you will, that sort of says, hey, Michael Gleeson hasn't had his colonoscopy yet, or whatever the particular measure or focus might be, or if you've pinged them with one of these, sort of screener and care team extension capabilities, the virtual care concepts, that information is readily available back at the point of care. Like Michael responded to a COVID-19 screener. He mentioned that he was short of breath, but otherwise feeling fine, and didn't request any additional help. And that is something that you would see right as you were going through a more traditional visit. And it can overlay on top of any electronic medical record or any other system you're using. So it can even sit on top of call center systems or care management systems, which I think gives it a ton of versatility, and the integration effort is much lighter. So it's kind of a plug and play option that gets you almost everything you want. You get the information at the point of care, you get the control over it, how you present it. It just doesn't literally go back into the medical record. And for that, we need a more comprehensive integration, which we do with our more larger customers that are more experienced in pulling that kind of information into the EHR.
Thank you so much for taking the time to talk to me, Michael. This has been really interesting.